Hello, everyone. I'm back. This is Rockson Liu, a dedicated hernia surgeon in Emeryville, California. Today, I want to talk to you about how your interaction with your hernia surgeon should go and what are some of the questions you can ask. Of course, when you first meet a person, you're looking for first impressions, how well the surgeon is dressed, etc. But I can tell you, I like wearing scrubs. I like wearing casual clothes. I don't wear a shirt and tie. I think it should have no reflection on who I am as a surgeon, technically in the operating room. I know I'm a very good surgeon in the operating room. I try not to look like a slob, but sometimes I like to wear scrubs, and I can look a little disheveled, but it really should have no bearing on how good I am. So I would say that's not a reliable indicator of how good your surgeon is. I've met plenty of very, very well dressed hernia surgeons, and I've been in their operating room, and I wouldn't let them touch anybody that I care about. Okay, I shouldn't say stuff like that online, but it's true. I have been proctoring surgeons for over 10 years now, and I've seen a lot of what happens in the operating room. So I have that insight. I know what surgeons are doing in the operating room. I know what they're like outside the operating room. I look at their Google Yelp reviews. There are some five-star surgeons, again, that I would not want them to touch anybody I care about. So first impressions are important, again, and the way they dress is important, but it really does not indicate how well they do in the operating room. Experience. People think that a experienced surgeon, somebody who's further out from training, is going to do a better job in the operating room, and I can tell you that that is not a good surrogate either. There are plenty of very experienced surgeons who do a very bad job in the operating room. The number of years they've been operating on the robot, I would say that's also not a good surrogate for how good they are with the robot. It's think of this like let's say you're learning how to golf. Okay, you want to get really good at golfing, and what do? You go out and practice and practice and practice, and you golf, right? And you get better and better with practice. So the amount of time that you practice is important, right? How closely you space those practices is very important, right? So if I want to learn golf and I go once a month, I'm never going to get very good at it, right? I could practice for 30 years, and I don't think I'll be very good at it because I'm just doing it once a month, and it'll be like relearning how to ride a bike every time. But if I go practice every day, every other day, I'm going to get better much faster, and I will continue to improve, right? Now, at some point, I may need a coach, but if I just go practice a lot, back to back to back, I will get really good. And it's the same with surgeons. Some surgeons can say they've done robotic surgery for 15 years, but maybe they've only done 50 cases in 15 years. That's what, 3 or 4 cases a year? That's one every 3 months. That surgeon is not going to be very good at robotic surgery. Okay. Now, the robot itself is a very complicated machine, and it takes a lot of operations to get good at it. I would say several hundreds. And the surgeon has to do several hundred in a short amount of time, not over a long period of time. So find out from your surgeon how many robotic surgery they've done, or how many laparoscopic surgery, or how many open surgery. Regardless of what surgery it is, how many have they done? And in their learning period, how many did they do let's say, a year or short amount of time, right? So if your surgeon, let's say, they're fresh out of training, maybe they're 2 years into their practice, but they said that they've done 600 robot cases already. That's a lot, right? That's somebody who's done 300 a year. So that person is very good with the robot, okay? So find out, the volume, the number of years of practice, but really dive into like how dedicated were they in learning their craft, learning the robot platform, etc. Another thing that you can ask about is, or maybe before asking, listen to what they have to offer. Okay, when they are talking to you, are they really discussing all the different options for the hernia surgery? Do they talk about open surgery? Do they talk about mesh, open mesh surgery, which is usually Liechtenstein repair? Do they talk about tissue-based repair, usually a Schuldeis repair, right? Do they offer those? If they don't offer those, then they're probably not a dedicated hernia surgeon, because I guarantee you a dedicated hernia surgeon will talk about open methods for umbilical hernia repair, right? There's open suture repair and open mesh repair. When they talk about laparoscopic surgery, what techniques do they actually mention the technique? Do they say TEP, TAPP, or IPOM? Those are all terms that they should be throwing out and explaining what they are. And then robotic surgery, do they offer robotic surgery? What type of technique? Do they go over the pros and cons of each one in detail? The dedicated hernia surgeons like me, I really feel like it's important for the patients to be well informed of their options. And somebody who is dedicated to their craft and really helps the patient understand things probably has that dedication in the operating room too. But that's not always the case, but that's a very good sign. When they talk to you about your history, especially if you have a complicated past with hernia surgery, like a recurrence or some kind of complication related to hernias, such as mesh infection, do they dive into details about that? Do they ask you about where the surgery was done, when it was done? Do they try to get the operative notes? Do they try to get the CT scan and look at the CT scan? Things like that, because the more information I arm myself with going into the operating room, the better prepared I am to tackle whatever issue is in there. If I can anticipate what issues are going to come about, then it's easier for me to get through that surgery. Otherwise, I'm kind of guessing. Okay, so what kind of questions the surgeon asks you is very important. Other things that you can find out, and this is not with the surgeon sitting in front of you, but just online. What kind of activities do they do related to hernia surgery? Are they being interviewed by other surgeons, right? A good one, is have they been on Dr. Tofai's hernia talk, right? She interviews all hernia surgeons from around the world. Has that surgeon been interviewed? Okay, so that's one sign that they are good at their craft and they have something interesting to say related to hernias. So that is one thing you can ask about or find out online. What else can you find out from the surgeon? Another one is, does the surgeon actually show you the meshes that are being used, right? Mesh is really the standard of care in the United States. So a surgeon should be showing you the permanent meshes that he or she is going to use. If you have an inguinal hernia, what mesh are they using? Pro Grip or Bar 3D Max or a flat sheet? Have them explain to you why they use that mesh, and they should be able to articulate it and bring up the other mesh, right? So they use 3D Max, so why not use a Pro Grip? See if the reasoning is valid, right? If they're doing a ventral hernia repair, what kind of mesh? If they're using a coated mesh, right? That's a sign that surgeon is going to do something called an IPOM, which is an intraperitoneal onlay mesh. That mesh goes inside the abdominal cavity and will be in contact with your intestines, and that's why they need a coated mesh. If they show you a mesh that's not coated, then that means they're going to put it between layers in the preperitoneal space or the retrorectus space, so the mesh is not inside the abdominal cavity. And if they show you the uncoated mesh, meaning they want to put it in the preperitoneal space or retrorectus space, those are technically challenging operations. So ask them, how often are you successful? How often do you have to convert and put the IPOM mesh in, which is not as ideal in my opinion. And I'm going to get into this in a lot more detail in my future videos. But yeah, in general, I would say in 2026, there should be less intraperitoneal mesh put in, because we know that long term, those meshes could erode into the intestines. They're more likely to get infected. If it's infected, it's harder for the body to clear the infection, and the mesh is going to have to be removed, et cetera, et cetera. So you want to ask the surgeon, how often do you convert to an IPOM, intraperitoneal onlay mesh repair, or how often do you convert to open surgery from a robotic operation? Okay, and ask them, how do they know their results? Do they keep track of their results? There's an organization called the ACHQC, which is an international database. Has a surgeon, put data into that database. Now, I can tell you, as a solo surgeon, it is extremely cumbersome to put data into that database. I was doing it a long time ago. Well, not a long time ago, but several years ago, and it was just overwhelming. At an academic center, they have a lot of folks that can do that for them, but as a solo practice surgeon, that is very hard. So I currently don't put data into the ACHQC, but I do keep a personal database of all the patients that I've operated on, and I will routinely call patients up every few years just to find out how they're doing. For the really complex hernias, I do scheduled annual follow-up. So I know how my patients are doing, and I know if they have any complications, because in the United States, there's no hernia registry. So if we don't we don't keep track of our own patients, we really don't know how our patients are doing. And a thing that we always joke about as surgeons is a surgeon will always say that they have no recurrences, they have no complications. And the reasons they think they have no complications or no recurrences is because the patients don't come back to see them, right? I find that a lot of patients are actually kind of embarrassed to go back to see their surgeon. Or, of course, if they had a complication, they want to go to a new surgeon. So the original surgeon actually doesn't know about their complications and their recurrences unless they call them and they follow up with their patients. So ask him how they follow up with, how they perform the follow-up. If it's there's one visit and then after that there's no more follow-up, then that surgeon really doesn't know their outcomes, and maybe they have a lot of complications, they just don't know. And then ask him, what happens if I end up with a complication? Well, what do you do? Just kind of an open-ended question, and just see how they answer it. Every surgeon has complications, even I do. That's just part of life. The human body is so complicated that we don't have all the answers, and some patients will just have complications. Or if you've had a recurrence or a complicated hernia pass, your complication rate is going to be higher, and you want to have that surgeon who is going to be there to help you navigate through the complications or the challenges after surgery. So ask your surgeon, just open-ended question, how do you deal with patients who you have a complication, and see how they respond. I can tell you, a lot of surgeons, what they want to do is they want to just operate on the patients, collect the money, and then try not to deal with the patients after surgery, because the 90-day follow-up is not paid for, the follow-up visits after 90 days are not compensated well. So most surgeons don't want to deal with any of those issues. So I think I covered a lot of ground, and I don't want this video to be too long, so I'm going to end it here. Those are kind of the things that come to mind when I think about how you should find a surgeon. And stay tuned for more videos. All right? Take care. Have a nice day.